It is no secret. The coronavirus outbreak is wearing out healthcare workers across the nation.
And Virginia, of course, is no different, and concerns are growing that the burnout is going to lead to serious staffing shortages in the medical field. 10 on your side, Stephanie Hudson is here to talk about the worries among nurses. Stephanie.
Tom and Anita, the Virginia Nurses Association is basically crying out for help today. They held a virtual news conference to address what they call a recipe for disaster: the influx of unvaccinated patients due to the Delta variant surge and a nursing shortage that's getting worse. Remember this? At the beginning of the pandemic, people celebrated healthcare workers, calling them heroes. 18 months later, Virginia nurses say they're often under attack.
Those double doors open, and sometimes it's like an angry mob.
A panel of nurses from across Virginia talked about the toll it's taking.
We have had suicides of nurses and other healthcare professionals.
A look at the state dashboard shows Virginia has plenty of hospital beds to care for COVID patients. These nurses say the problem is there's not enough of them to go around.
We're all spending every day, every shift, trying to figure out how to move nurses from one area to another so that we have some semblance of safe staffing.
And now they say some nurses are leaving the profession altogether because of the physical, mental, and emotional stress.
You might have to change your scrubs 3 times a day because you have sweated through your nursing uniform. You know, just the work intensity of trying to rescue and stabilize a COVID patient.
A big man gripped my hand and just hold my hand and squeeze it so hard that it hurt and tell me how afraid he was.
Imagine the worst day you've ever had at work, then add human suffering, death, personal risk, and repeat it every day for 18 months.
Their message today?
We've been the front line of this pandemic for the last 18 months, and what we're asking the community to do now is for you to be the front line.
Get vaccinated, wear a mask, and help your community. Now, several nurses on that panel have more than 2 decades of experience and say that this is the sickest they've ever seen patients, and they're now seeing more people in their 40s and 50s dying. All of them, they say, unvaccinated. Stephanie Hudson, 10 on your side.